Hello, everyone. Today, we've gathered to talk about an important health issue that many people are concerned about: cardiovascular disease. Cardiovascular disease is a critical health issue in today's society, and in this session, we will be discussing the causes, symptoms, treatments, and prevention methods of cardiovascular disease with Drive. Kim, it's great to have you here.
Hello. I'm happy to be here to discuss this important topic. Cardiovascular disease is a significant issue for all of us, and I hope this discussion will be helpful to many people.
First, can you explain the causes of cardiovascular disease? What are the main reasons people develop cardiovascular diseases?
Yes, there are several main causes of cardiovascular disease. One of the biggest factors is high blood pressure. High blood pressure continuously applies pressure on the blood vessels, which can damage them and eventually lead to cardiovascular diseases. Another major cause is high cholesterol, where excess fats build up in the blood and narrow the blood vessels, increasing the risk of disease. Additionally, factors such as smoking, obesity, lack of exercise, and stress all contribute to the increased risk of cardiovascular disease. Lastly, genetic factors cannot be ignored. If someone in your family has had cardiovascular issues, it's important to be extra cautious.
What symptoms should we watch out for in cardiovascular disease? Could people misunderstand some symptoms?
The symptoms of cardiovascular disease can vary. Chest pain is one of the most common symptoms. If you experience chest pain or pressure, especially during physical activity, it's a sign that you should consider cardiovascular disease. Other symptoms include shortness of breath, fatigue, and dizziness. Sweating or nausea can also be early signs of cardiovascular disease. If these symptoms persist, it's essential to visit a doctor for a proper diagnosis. The initial symptoms may seem mild, but early diagnosis and treatment are crucial.
So, how is cardiovascular disease treated once diagnosed? Can you explain the treatment options?
The treatment for cardiovascular disease depends on the type and severity of the condition, but there are generally two main approaches. The first is medication. There are medications available to manage high blood pressure, high cholesterol, and other conditions, which help improve blood circulation and reduce the burden on the heart. The second is surgical treatment. In more severe cases, procedures like bypass surgery or stent insertion may be required. Additionally, improving lifestyle habits is critical. Following a healthy diet and exercising regularly are essential to maintaining cardiovascular health.
Finally, what can we do to prevent cardiovascular disease? Are there simple prevention methods that we can practice in our daily lives?
Yes, cardiovascular disease is preventable, and that makes it an even more important issue. The first thing is to maintain a healthy diet. Eating foods low in salt and fat, while consuming plenty of vegetables and fruits, is very beneficial. Additionally, regular exercise is a must. Exercising for at least 30 minutes, 5 days a week, can significantly reduce the risk of cardiovascular disease. Quitting smoking and avoiding excessive drinking are also critical. Finally, managing stress is very important. Techniques like meditation, deep breathing, and yoga can help reduce stress and prevent cardiovascular disease. Regular health checkups are also essential to detect and manage early signs of high blood pressure, high cholesterol, and other risks.
Today, we've covered a lot of information about cardiovascular disease. Kim, thank you for taking the time to share this valuable information.
Thank you. I hope today's discussion will help many people. Everyone, take care of your cardiovascular health.
We'll continue to provide more useful health information in the future. Please subscribe and like our video, as it really helps with our production. This video was made with the help of AI. Thank you.